Welcome back to my YouTube channel. My name is Dr. Shumard again. We're gonna focus today on specifically some underlying causes to your type 2 diabetes. And as you can see here, I've got a little diagram for you guys because I wanna just emphasize again that for those of you who are just watching my YouTube channel for the first time, your diabetes is not due to high sugars. Your elevated sugars are specifically a symptom of your diabetes and not the cause. But what is the cause of diabetes? Well, diabetes, if we look at this specifically, is a cellular disease. Right here, I have drawn out for you guys. This is the cell. And when we look at sugar, sugar gets formulated in your gastrointestinal system from your food, and we have that highlighted in blue here. But your sugar alone will do nothing. It needs insulin. So this is the key component to what's happening inside your body, which is why many of you are probably taking insulin, not because your pancreas is not producing enough insulin, it's because your body is overwhelmed at the cellular level. So just normal physiological function is we have glucose circulating in your bloodstream. It attaches to the insulin. The insulin and the sugar then come down, leave the bloodstream and go into down to your cells. And at the cells, there's a little sensor there, or also referred to as a receptor, that the insulin will attach to. Once that happens, it's going to open up a section, whoops, didn't mean to do that. It's gonna open up a section of your cell. If we draw the cell again, it's gonna open up a section of your cell once the sugar comes down and then it enters your cell. So again, we have the insulin comes down, attaches to this receptor, and then that receptor opens a door in your cell which allows the sugar to enter. Now, once the sugar gets inside your cells, that's where all the action happens, because this is where you're able to create that energy and normal function. So this is why it's so important for you to be able to regulate your sugar. Imagine if you had a car and you put gas into your engine of the gas tank of your car, and that gas never made it to your engine. Where would your car go? Nowhere. It would just be sitting there doing nothing. Well, the same thing happens at the cellular level. Now, when you have just a couple of these cells that are damaged, no big deal. But when you start to have millions of these cells damaged, that's when you have the inability for the sugars to get into your cells, and those sugars start to go back to your bloodstream, increasing glucose. And so eventually you get a diagnosis of type 2 diabetes, and then that's when you have this problem developing. This problem takes many, many, many years, in some cases 10 to 20 years to fully develop before this actually occurs. Now, as a type 2 diabetic, this whole scenario is still happening, but the problem happens right here. The inability for the insulin to attach to that receptor and the inability to get the sugar into your cells, right? So this is where the problem occurs. When this is broken, that sugar is then going to continue to go back up into your bloodstream because it can't get into your cells. And that's when you get this diagnosis. So the question is, what is causing this? Why is this happening? This is what I want to talk about as some of the most common causes of this problem occurring. Because unless you fix this, your diabetes will progress over time. Because this problem will impact the next cell, the next cell, the next cell, the next one, and just keep on happening until you no longer have the ability to maintain your own sugars. So what are common causes of this? Well, one of them first is we have multiple organs that are involved in blood sugar regulation. One of those organs is your liver. Liver has multiple components to regulating blood sugar at the cellular level. So is your liver working properly? Many diabetics that I meet with, they don't. They have something called fatty liver disease. They have liver damage. Their livers are very sick. And so this could be an underlying culprit to your inability to go back to managing this situation right here and causing these blockages at your cellular level, and then the elevated sugars going up. Another problem that we see is the adrenal gland. Now, your adrenals are very important. They sit just above your kidneys and they have multiple functions. One of its primary functions is blood sugar regulation at the cellular level. How are your adrenals functioning? Well, there's ways that we can find out. Do you have weight gain? Do you have brain fog? Do you have sleep issues, energy issues? Oftentimes, these are symptoms associated with an adrenal problem, and these adrenal glands have to be evaluated appropriately to identify, are they a culprit contributing to your cellular damage? Another area that is problematic is the GI. Remember, all of the blood sugars are derived from your gut. So if your gut is not working optimally, you may not be releasing enough sugar or releasing too much sugar and impacting the body. But the gut is a very important component to blood sugar regulation. And if you have symptoms of gut issues, right? Constipation, bloating, gas, just acid reflux, those are oftentimes indications of a GI problem. But even if you don't have those symptoms, you still could have this absorption or digestion issues that could be contributing to that cellular damage at the cells themselves and progressing your diabetic condition. Now, another area that's heavily involved in this is the thyroid. Your thyroid is huge. It sits at the bottom of your neck here, and it produces a hormone known as thyroid hormone. Very simple and easy to remember. Well, the important thing about thyroid hormone is it is an essential hormone for cellular function, meaning if you don't have enough thyroid hormone, then you can't have normal cells, and this is going to happen at your cellular level. So this is a big issue because many individuals that we meet with have thyroid conditions. They're taking thyroid medication, etc. Why are you having to take that thyroid medication? In many cases, the thyroid has been damaged or there's problems going on there that are contributing to your thyroid issue, which is then going to create a domino effect at the cellular level and regulation of blood sugars. Another area, obviously, is the brain, right? The brain is a huge component to overall function. It controls every single system inside your body. And if your brain is not working optimally, it's going to contribute to cellular damage. There's a condition that you may or may not have heard of called type 3 diabetes. Type 3 diabetes is essentially Alzheimer's and dementia because it's a brain issue, and it's heavily involved in many individuals who have type 2 diabetes. But again, the same mechanisms that are driving the Alzheimer's and dementia could be the same mechanisms that are driving your cellular damage. And a big, big problem that I really wanted to make sure we talked about here today are toxins. Because toxins are a huge issue that we're currently seeing. They're in our food supply, they're in our environment. We get exposed to these things. It can be things like mold toxicity, things like environmental toxins, and even heavy metal toxicities that we're being exposed to. And these are coming out more rampant these days, and more information that is strongly impacting that toxins are a big component. Because why? Because what toxins will do is they will get into your body and they will migrate to your cells and essentially block the ability for normal insulin and glucose to get into your cells. And if you continue to have exposure to toxins over many years, and I evaluate a lot of individuals, and some of the toxins they're currently experiencing have been in their body for 20, 30, 40 plus years, damaging multiple cells, and a big, big component and culprit to their inability to have normal blood sugar, i.e. the ability to get the sugars into the cells, causing the cellular damage. Imagine this. Imagine if you had a poor functioning liver, your liver wasn't working properly, you were diagnosed with fatty liver disease. Imagine you had adrenal problems where you had multiple issues, days where you don't feel good, you have no energy, no drive, no ability to sleep properly. Your GI, you have lots of symptoms here, your thyroid condition, brain, and toxins. Imagine all these were a problem going on inside your body, and all you were focusing on was trying to lower your sugars. Is that going to fix your cells? No. You see, this is why it's so important to get properly evaluated to understand what problems you're currently dealing with, so then there can be a customized solution, because we have to fix the liver. We have to fix the adrenals. We have to fix the gut, the thyroid. And if you fix all those problems, what's going to happen to your cells? Well, this is going to go away. And your body can start pushing your sugars back into your cells. And guess what happens to your sugars, your blood sugars? They normalize and you become a non-diabetic. So hopefully this is starting to help you to understand that some of the causes of your diabetes go well beyond focusing on sugars. We have to focus on what's truly going on inside your system. What areas are broken that are contributing to your cellular damage and the progression of your diabetes. All right, you guys, I hope this was helpful information for you today, and hopefully it was something that's helping you to try to find out your cause and to get your solution to truly reverse your diabetes. Make sure you're on the lookout for our next week conversation. We'll go more into depth about what diabetes is, how it's impacting your body, but more importantly, what you need to do to start reversing your diabetes. Take care.